My name is Catherine Kamau. I am a nurse practitioner, doctoral prepared. I'm a nurse practitioner in neurology for many years. I always wanted it to be in healthcare and medicine in particular from when I was very young. I was a kid that struggled with asthma and eczema and all that. So I was among healthcare providers a lot, and I wanted to be one of them. Once I finished college, I went into nursing immediately. And then I kept advancing it so that I could do more and more, and finally got my doctorate in 2019. But I have loved every minute of it. I have loved patient care. I've always loved caring for people. I think naturally I'm just a caregiver and an educator. So for many years, my special interest was epilepsy. I did a lot of diagnosing, localization, surgical workups, and all that. But I developed a very big interest in women with epilepsy, the childbearing potential, the interaction with medications, a lot of the issues that women worry about. I realized that we have more questions about life in general, pregnancy and stuff, and contraception, especially when you're dealing with a chronic illness. So that has been a big interest of mine. I think patients need to trust you. They need to buy into the process. And as a nursing background, I've learned this over the years, is the more they understand what you're talking about, the more you can break it down to their level and teach it to them, then they will more likely buy into the treatment plan and follow through successfully. I have not found good outcome when people are just told what to do and how to do it. They just need to believe in that you know what you're doing, that you have their best interest at heart, and that way it's a good outcome for all of us. I'm not wasting my time and you're not wasting your resources. Even for patients with limited understanding, you just have to make the effort to teach the caregiver, teach the mother, just make sure somebody gets what we're doing. Because it is their chronic condition to live with. I think they need to understand. Well, I need to understand their anxieties about it and help support how they get into the treatment and how they understand it. Really, it's about the patients. It's not about me. I actually tell my patients, whatever I'm doing or whatever we are discussing, do it for you and not for me because, it is your healthcare. You're the driver of this. I am the co-pilot. I'm guiding you through it. I'm directing, I'm instructing, I'm correcting. But really, it's your healthcare. For my family, because I am the healthcare person, I have always been the support, the researcher, the informer, the educator, the one to look up things and see who can treat this, can I refer to this, I've really just been an anchor and a support and I've kept it open that way so that people can approach me with whatever questions, whatever support they need. I think my eczema is still my chronic condition. I've had it from childhood. I still struggle with it. Much of it shows up when I'm anxious, when I have been careless with my triggers. I have lived with it all my life. I've kind of understood that moisturizing is important. Managing anxiety is important. I know what my limits are. When I notice that I'm getting anxious about something and my hands start to flare, I do my breathing exercises. I talk to somebody, and it just calms things down. Of course, every so often I have to put a cream on it,